So patient says, explain to me this whole procedure in 30 to 60 seconds. This is simply how it works. You will actually meet your surgeon on the preoperative consult. And then sometimes you may have to meet them a couple of times after that. During that process, your surgeon may need to do an endoscopy, might need to do an ultrasound, will definitely do blood work. You will definitely be seeing our bariatric dietitian in the bariatric center who will go over what is your ideal intake of protein, of sugars, of fats. What kind of diet will you be having before the surgery, immediately after the surgery, on week 1, on week 2, on week 3, and so on moving forward. Those are extremely important, obviously. And then once you fulfill and we meet all the requirements, because remember, the whole idea behind this is to get you in the best shape possible so we can get the best results possible, and this operation is as safe as possible. Once we met all the requirements, then you'll have your preoperative visit. On the preoperative visit, you'll come to our office, you'll meet your surgeon, we will answer any last questions that you have, for example, and then we will get you down to see the anesthesia team. So what we've decided to do is do the preoperative visit to make sure that the simple blood work, your electrolytes, your blood count, your liver tests are all normal before we proceed with surgery on the day of surgery, which is usually within about a week after you do your preoperative visit. If you have any last questions, we would also recommend that you go see my dietitian or dietitian at the bariatric center so you can go over any diet questions that you have. Nonetheless, we will still be with you after the surgery. Our dietitian will call you once a week after the surgery to make sure you're on the appropriate phase diet. And then we will also tell you what kind of multivitamins to take. You do not need to take multivitamins immediately after surgery. Definitely not for the first 2 weeks. You will start your multivitamins on week number 3. If you do not take any of the recommended vitamins that we have, and we do not own any of those, but we look at them so they meet the requirements that the American Society of Bariatric and Metabolic Surgeons recommended, then we would like to see those actually multivitamins that you have found. There are a lot of new companies coming up online and people order them because they're perhaps cheaper, easier to access. Then we absolutely do not mind that as long as we can look at those and see what is the content and do they actually meet your requirement after the surgery.